Hello and welcome to Bristol Health Cares. I'm your host, Kirk Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Welcome to Bristol Health Cares. I'm your host, Kirk Barwis, and I am excited to be here today. And I have two amazing guests with me. I have Rebecca Colasanto and Lisa Coates with me. We're going to talk a little bit about behavioral health, and we're going to talk about today how we connect with the community services, different programs that we have. But first, Rebecca, how about introducing yourself a little bit?
Sure. I am a licensed clinical social worker, and I've been with Bristol Health for 18 years.
Wow, 18 years. One more year than me. Lisa?
My name is Lisa Coates. I'm a licensed clinical social worker also. I've been with the hospital for 12 years.
Yeah, that's great. So today the focus is on really how do we connect with the community? We get this question all the time. In fact, as a nonprofit community healthcare organization, we actually have to demonstrate that we actually do outreach, we connect to the communities and things like that. So talk to me a little bit about the programs that we have, and I think we could start with the COBRA program, which I think is really very exciting. Who wants to take a shot at that?
Yeah. So COBRA to me is just a super exciting program. It started when I joined the Mayor's Opioid Task Force, so back in 2018. And then after one of the sessions, the chief came up and asked Chief Gould, if we were interested in maybe, it's the HOPE program. So Manchester has their HOPE program, which offers basically anyone who might be at risk of being arrested for misusing a substance, heroin specifically, opiates, that the option of treatment versus arrest. So it gives the officers options. It helps give a pathway to treatment instead of just putting people back in the system. So I was like, Chief, I don't know. We've got a lot of initiatives going on. So Let me just talk with the staff. And they were all so supportive and receptive. So within a month, we had our first meeting, and it included Marco Palmieri, the Burlington Bristol Health District Director, Chief of Police, the Mayor, Ellen Zappo at that time, EMS, Dave Kashuk, and Beacon Health Options was there. So it really included a lot of key stakeholders, and everyone was on board. It was the quickest 30-minute, most productive meeting I have ever had. And at the end of that meeting, we decided that because Bristol, we're just special at everything we do, that we wanted to name it ours. And we also didn't want to restrict it to only opiates. So we wanted to give people an option if you're, addicted to alcohol or using, whatever substance you're using, you could have a treatment option. So that's where we came up with COBRA, which is the City of Bristol Recovery Alliance. And really it's a philosophy that we all kind of joined in on, that if you go to the police department, if you come to our ED, if you're in the community, it gives you the opportunity to say, I really want to engage in the COBRA program. You'll be brought to the emergency room with a non-medical EMS transport, and then there they'll triage you. So what are your needs? They'll go through, do you need residential? Do you want residential treatment? Do you need a detox? Would you like medicated assisted treatment? So the crisis clinicians will meet and assess after they're medically cleared with what options they can go through. We also have recovery coaches who can help if they go off to rehab or another facility, they can help transport, and their peers in recovery who can help talk them through what to expect as well. So, and then we, Dr. Lim and I, we walked around, literally walked to other agencies and identified COBRA appointments. So one of the biggest obstacles for treatment is like the barrier. So trying to call a place to get an appointment, right? Sometimes you're never going to get through. Sometimes no one calls you back. So we wanted to have specific appointments that if you're in our ED, we can definitely connect you with an appointment in the community based on your needs that day. So we got COBRA appointments throughout the community. And now it all got up and running, and then COVID hit. So, people avoided the emergency room in all hospitals because they were terrified of COVID. So, but it's maintained. And so we're going back through, and today actually I'm retraining EMS and the team about COBRA as an option. We're going back through the police call lineups to reintroduce the program to them as well. So that's one way that we're supporting the community. Super exciting. It's really nice to be part of a community that believes so much in giving someone options, and that recovery takes more than just that first time. People usually might overdose, they're surprised, there's bright lights, similar to right now. It's disorienting. So it's kind of like, how do we help people normalize the fact that it does take maybe 15 times before you're ready to make that commitment to getting
But
better.
it doesn't have to be 15.
It does not have to be. You don't want it to be.
But you also don't want to stop offering recovery.
Yeah. Right.
There shouldn't be no, I'm sorry, you didn't make it.
Right. We saw you 2 days ago.
Right.
What's different today? It's really one of my favorite stories is that we had this aunt and her nephew in a domestic. So police responded to a domestic, and the son was under the influence. And so the officers were able to offer him treatment. And he came and engaged in the program and decided that it wasn't worth the arrest and going down that path, and was able to enter a life of sobriety, which was really cool to see all the pieces work together like that.
So thank you for sharing that, because I think that's what people need to hear, is that, even though sometimes it doesn't work the first time or the second time, there is hope that if you keep at it, eventually, people can overcome, and their whole life is changed. And it's not just their life, it's the life of their family, their loved ones, their friends, everybody that interacts with them. And I think that's the beauty of that kind of a program. We do other things that are kind of really unique and special. That program being one, and I'm glad to hear we're re-engaging that now that the pandemic is kind of starting to wane. But how about like the interaction that we have with, the community care coordination team, for example?
Yep.
To me, that's something I talk about when I travel and talk to my peers around the country, and people talk about how expensive it is to go after like social determinants of health. So we provide health care, but what could be causing the health problem it's related to a food insecurity or a housing problem, that they don't have a roof over their head, and so they can't get the proper food to eat, or they can't take care of themselves. They don't have enough money to be access to the doctor, or other health providers. The community care coordination team has been alive and well for a long time. Yeah. And like I said, I've used that and talked about it widely because it really doesn't cost anything, does it?
No.
So how does that work?
Really, our local community partners all donate their time to join us at least once a month in a forum that is, very conversational, where people who are recidivisms of any of those community organizations, including ours, where we can identify there's more going on and we need more brains thinking about what could help this person to decrease how much healthcare they're accessing, especially the type of healthcare they're accessing. It's not always behavioral health or addiction services. It really could be medical services. You know, someone who's on dialysis and is constantly readmitted, you know, what's going on in their household? How can we help them? One theme that comes up a lot in our CCT is homelessness and how that drives frequencies to our healthcare system and the other community organizations. So we've had amazing success stories. I don't think it's always what comes to mind, and I think, you know, there's still times when people say, you guys have to do more. You know, why isn't the hospital doing more? But we do so much, and some of those success stories are, you know, you never would have guessed that we could help someone so much.
Yeah, so for the viewing audience, you guys meet like monthly, bi-monthly?
Once a month.
Once a month.
Yep. Yeah.
And so everybody brings their lunch, brown bag lunch, so they bring it with them, and they meet in a conference room, and individuals that are in this program opt in to be in the program.
Correct.
So they at some point come to the emergency room or enter some part of the system in our community and opt in for it. And then each person, you talk through the individuals when you meet, and you talk about their needs. What are their specific needs? It could be housing, it could be, you know, access to behavioral health services. It could be all kinds of things. And what I find really incredibly amazing is that individuals take ownership in that room. So they say, you know what, I'm going to work on this. It could be housing, it could be something, whatever it is. And they kind of hand over their cell phone number and say, you know what, because sometimes the place that you get to interact with those individuals is in the emergency room. You mentioned that. It's kind of a common, you know, unfortunate theme because they run into trouble and they end up in there. And then when they end up in the emergency room, or if we do have a cell phone number, that the individuals are connected with those services immediately, which is quite amazing. And the success stories that I heard, you know, people actually go from really struggling to now having, you know, a life that maybe they only thought was remotely possible for them. So, did I get that right?
You did. You did a good job. Yeah.
It's just, it's just amazing what people can do. And the thing that I look at is that, you know, it's not like Bristol Health has extensive resources and is like this system that can just go out and build a new housing unit for, you know, for homeless people or individuals. But we can still accomplish things in a way that is very efficient, very effective, and creates just incredible outcomes.
You know, one of the things I've learned from that team specifically is people wait for housing forever, you know, so we'll have people in tents and sleeping on couches, you know, wherever, and then they finally get their housing opportunity. And so they get this apartment and it's empty, completely empty and lonely. And, you know, everyone's like, well, why don't they want to stay in their apartment? Like, why are they back in the emergency room, or why are they back on the street? And through that team, we're able to help put resources in the apartment and make it a home for that person. And then they are much more likely to stay because it's comfortable. You know, it's not just four walls.
Right, with no bed, no TV, no amenities, no dishes. So we've watched those community partners come together and say, we've got all this stuff. We'll be at the house and we'll
rally together.
We'll set these people up.
I didn't realize that happened.
Yeah.
That is so exciting.
Yeah, it's really nice.
So it's the people that come to the table, or other people that.
Yeah.
Really?
Yeah.
So how does one so if you have stuff, where do you get the stuff from? That's going to be my question.
A lot of resourceful people.
People donate. I think people love to donate things. You know, I think that they love to help out other people. A lot of people don't know where to donate to, or some people get so many items that they're not sure what to do with. And so that's why that team is so amazing, because some people might have more supplies than others. And so how do we share resources and get the patient what they need?
That is really truly incredible. And so that's once a month that happens. And so I would say this to the viewing audience, you know, if you know someone that needs help like that you think, you know, maybe it's hopeless for that, or you can't help that person, you know, reach out to them. I say this all the time. It's it's really important to notice things, you know, especially in your own community, on your own street, maybe in your church, maybe in whatever organization you go to. Take notice of people that seem to be struggling, and you know, it's not like you know, get in their face or anything, but a kind and gentle, how are you doing today, really makes a difference, right?
It does.
And that's how I think we rebuild our community. And I can tell you there's been times when I remember this time, I think Rebecca, you were involved with me on this one. I was running for a meeting one day, and my assistant said to me, there's this person on the phone that did work at your house and wants to talk to you. And I'm thinking to myself, all right, I'm late for this meeting, I gotta go, I know this person, but this person is not working at my house now and hasn't worked at my house for years. And so finally I stopped and I said, okay. I picked up the phone, and the conversation was, kind of strange to me because, this person just wanted to talk. And then after just a short, interaction, I kind of stopped thinking about the meeting, and I started thinking to myself, okay, why is this person calling me? What's going on here? And that's when it happened. That's when that person said to me, I don't feel good about myself. I don't feel good about being in part of this world anymore. And I connected that person with, I think you, Rebecca, and we were able to get that person help. But I constantly replay in my mind, what if I had to just run off to that meeting? And so I think the my message to people is, we're all busy and going places and doing things, but there are opportunities to help people that only come in this little sliver of a point in time. And what I want you to know is there's help out there. If you call the hospital, so if you encounter someone who's in trouble or in distress, and you call the hospital, what happens to help that person?
Well, it really depends.
It depends. I know it depends, but the operator knows what to do, right?
The operator knows what to do. The operator knows what
Yeah.
The 988, the 211, or if you can get another human. If you can't get a human on the phone, you've got to use our emergency numbers.
I have to say that I think we're the recipients of a lot of
Sure.
oh no, I don't know what to do, which I love. I would never change that for anything. But people are so good at calling and asking for help, and I really feel that any of our medical offices know that they can call us if they have any questions. Because it's complicated. Every time is a little bit different, and we don't want to make a cookie cutter decision for people because everyone's so unique and has different life stories. So. But yeah, I think people are really trained well. I mean, we have QPR as part of our general orientation now, so people are really trained as to how to help support people in crisis. So,
yeah, I think for me personally, it's recognizing that you have to kind of stop, and you have to say, and you have to be honest with yourself. You may say, I'm not going to deal with that because I don't know what to do. Mm-hmm. But that's not really the right answer in my mind. The answer is I'm going to stop, help, and I'm going to try to connect people with those services.
And most times people just want someone to listen. It's the stopping and helping. It's most of the time we just listen. It's really more about providing a space for someone to kind of just share what's going on and not being too busy.
Yeah. So let's talk about another program that we have, the WIC program, right? Mm-hmm. You and I just had this exciting meeting with the team.
Nice.
It was kind of like the first time, because we cover Bristol, we cover Southington, New Britain, we go all the way up to Litchfield County. It's an expansive program.
Huge.
So what is WIC?
The biggest in the state.
It's we're little Bristol Health, biggest in the state with WIC. So what is WIC?
It's our Women, Infant, Children program. So it's a state-funded program. So we partner with the state on this and really offers support to women, infant, and children for nutritional supplements. So anything from like breastfeeding support to how to properly eat, so that way you stay healthy and successful. So, yeah. It's such a big program though. There's so much more to it than just that. But,
yeah. It was really exciting to hear. So we went around the room and everybody introduced themselves. To your point, most of the people in the room were nutritional counselors, but they do so much more to help women who've had children, babies, and connect them with resources. And one of the things I heard about a lot was postpartum depression.
Yes.
And the ability to identify it. And so I don't remember the whole detail, but when they identify that, what do they do? They connect the individual with support services and things like that.
Yeah, I think our we've gotten really good as a society at screening for postpartum depression because it is such a real issue for a lot of new moms that no one likes to talk about. It's like, let's have kids, it's going to be fun.
It's going to be great.
And it is fun, and it is beautiful. But it's been extremely challenging. And the hormone, everything is going. So the fact that they're able to kind of normalize it and see these women through subsequent appointments and be able to offer them options. So like the counseling center, so they can refer them to therapy. They can, that's the best, but obviously as a new mom, you don't really have that many options, but just being able to know you don't have that much time to go and do therapy. But just knowing what's going on sometimes can help immensely to know, like, I'm not, completely, like, this is a normal process that women have to go through.
Yeah.
Too. Not everyone gets postpartum,
but it's also, the program also is really trying to prevent any kind of abuse as well, right?
Yes.
That's a big component. So how do they do that through interaction and assessment and trying to understand, and it could be spousal abuse, it could be all kinds of issues. I forget, the number of clients that they have is extensive throughout these areas. It's really quite incredible. I think what I really love about that team is there's not a person on that team that doesn't love what they do.
Yeah,
they are just dialed and wired for this. Like they feel like they're making a difference, and that, of course, I feel kind of guilty about this, but I that kind of transmits to me because I then feel like I'm helping out by supporting this program, and it's just really. I think it's one of the most powerful things about healthcare is, despite you were talking about the trauma and all the issues earlier, it has become challenging. We have a lot of violence in our environment. It's the top. If you look at workplace violence, it is by far 4 to 5 times worse than any other environment in the country. Yeah. And I would even count correctional things and stuff like that. So. It's an interesting time. Behavioral health is a key component of how we can, as a community, grow stronger together, heal together. But it takes everybody working together, everybody noticing each other and things to make it work. So, all right, we're coming to the end of this episode. We could probably go on for another 3-4 hours today.
Yeah.
But Rebecca, anything about the community programs that you want to share in closing out this?
I just think we're incredibly fortunate to have the community organizations that we have in the Bristol and surrounding area. We're just incredibly lucky because we're all just trying to make a better place. Yeah,
you're absolutely correct. We've had the unfortunate, incident that happened last year, and the community support and outreach. It was so incredibly important to how this community is healing, and it's got a long way to go. So thank you. Lisa.
I know we're almost out of time, so I just love our community. I just can't even speak enough about it. I think I appreciate your support, the whole hospital support, the community. The mayor, the police, everyone is just phenomenal. So it's a really exciting place to do some great work in. So
and we have lots more to do, and we're going to do it.
Yes.
So this is an exciting episode of Bristol Health Cares. I'm your host, Kurt Barwis, and I want to say special thanks to the Nutmeg team here. It's done just a tremendous job in supporting us and doing the production for us. It's an incredible community asset that I hope you all get engaged and support Nutmeg TV. You can write me. You can write cares@bristolhospital.org. You'll see a little blurb after the show that'll tell you how to do that. I'm very excited about bringing other guests onto this program. people that you want to hear from, interviewing them, and hopefully, spreading knowledge and understanding, and really working to improve our health in our community. So have a wonderful day. Until the next time, Kurt Bartels.